Now, according to the American Cancer Society, prostate cancer is the second most common cancer among men, and it develops most often in black men. We want to bring in Dr. Bayo Curry-Winchell. She's a medical doctor and health equity advocate. Doctor, thanks for being here. Black men are 1.7 times more likely to be diagnosed with prostate cancer and twice as likely to die than white men. What do we know about why black men are at greater risk?
I think when we look at it, we have to look at diseases across the board where black individuals are unfortunately getting diagnosed at a later point. And so when we think about prostate cancer and all of the symptoms that are often, really hard to identify, difficulty urinating, trouble or pain with urinating, often as black individuals, we are not diagnosed at an early stage. And so when you have that part, plus these symptoms that are sometimes silent, that adds to, unfortunately, this disproportionate rate of disease and prostate cancer that we see in black individuals.
And doctor, what exactly causes prostate cancer, and are there signs that people can be on the lookout for?
So we still are unsure exactly of what the cause is. But what we do know when it comes to cancer, it's this opportunity for cells, unfortunately, to divide rapidly. And so when that happens, unfortunately, that increases your risk for developing malignancy or cancer. And so with prostate cancer, the signs and symptoms that we mentioned are often not recognized until later on. And when it comes to cancer, especially with prostate, earlier detection is vital. And if you are an individual of color, that unfortunately is often getting missed. And so that's why we see that rate that you mentioned, 2 times likely to die from prostate cancer.
And doctor, how soon and how often should people begin screenings for prostate cancer?
So an important piece is to really look at family history. Often people aren't aware that, when we think of prostate cancer, we think of it as a male disease. However, if you have a family history of an individual, a woman who has had breast cancer, that increases that male's risk of developing prostate cancer. The other piece is to really look at your age, because as you get older, that also is an increased risk, and diet and other factors. So having a conversation with your healthcare provider, sharing your story, your health history, all of those things will really create that playbook of how often you should check in with your doctor.
We know that Austin's doctors say that his cancer was caught early and that he has an excellent prognosis, but just how difficult is prostate cancer to treat?
It's quite difficult. And so, we have some cancer, sometimes with prostate cancer, we can just kind of watch it and monitor it slowly. However, if it progresses, meaning where that cancer has spread through other parts of the body, that can make it very difficult to treat. And so at this time, of course, we have close observation, but we also utilize radiation and chemotherapy. But as time goes on, those opportunities to treat can really be lessened if you're in a later stage.
All right, Dr. Bayo Curry-Winchell. Doctor, thanks so much for joining us and shedding more light and insight on this important topic. We appreciate it.
Thank you for having me.